Hi friends, good evening. I'm Dr. Ashutosh Gupta, and let us talk about how does this pre-pregnancy diabetes affects the fetus. Okay, so now we are talking about exclusively diabetes, pre-pregnancy diabetes, insulin-dependent diabetes mellitus, and leading to fetal embryopathy. राइट सो डायबिटिक एम्ब्रियोपैथी के बारे में बात कर रहे हैं सो देर आर लॉट ऑफ क्राइटेरियाज बाय विच वी कैन really identify there is an hemoglobin A1C levels and all those stuff but on crux of the matter is this that probably we try to identify the congenital abnormalities associated with the pre-pregnancy diabetes. Okay, so this could be with the cranium, that is anencephaly, spina bifida, neural tube defects. We can have some cardiac defects like VSDs. We can have a transposition of great vessels. We can have limb defects also, and so limb aplasia and all those stuff can also happen. And cyanomelia can also happen. We can have some issues with the renal and very exclusive we can have a focal femoral hypoplasia, right, meaning thereby that the proximal part of the femur, whether it is unilateral or bilateral, whether it is involving the one leg or the both the legs, and the variable degree of the femur, they could be affected in the growth of the baby, and therefore which is called as a proximal focal femoral dysplasia, PFFD. Right, so these are all conditions, fetal embryopathy, fetal congenital malformations, which are very exclusive for the pre-pregnancy diabetes. So let us talk about one of the important cases, right, which is called as a PFFD. So look around, right? So these are the even though it is a club foot, but we identify knee joints are very close to the hip joint, right? So we could hardly see the femur. Both these are very small. So by great effort, we could identify the both of the femur, which is very minuscule, half of the length of the tibia, right? So this is the femur. This is the femur that we can identify. This is happening in both the limbs, and then the knee joint is closed opposed to the hip joints, right? And this is a micrognathia, right? So severe micrognathia, and we are having a type D variety of a PFFD, and therefore it is an Atkin classification. And so this is how it is. It could be A, B, C, D, and this is how it is. A pre-pregnancy diabetes, meaning uncontrolled diabetes, and therefore can lead to vasculopathy, and therefore that vasculopathy can lead to serinomelia, and or otherwise it can have a bilateral PFFD type 4, which is there in our case, right? So what we've identified that the femur were not seen initially, and they were in fact one third of the size of the tibia, and therefore it gave us this impression as if the knee joints are closely opposing to the hip joint. But if we look around closely, we could identify the femur, which is of very very small length, and then the micrognathia was there, right? So this is a type 4 or type D variety of an Atkin classification of a proximal focal femoral dysplasia, right? So that is how it is. And so this was a pre-pregnancy diabetes leading to PFFD, right? Thank you very much for your patience.